So we're at the current stage of data collecting. We've got up to this point, we've got ethics approval, and now we are collecting the data. So with participants, we ask a series of demographic questionnaires, and then from there, they get randomly assigned into a modality. There's 3 modalities that they can be randomly assigned into. There is VR with controllers, VR with haptic gloves, and traditional mannequin trainer. So they'll be learning the skill of inserting a Foley catheter into female genitalia. This is known as one of the most complex skills in nursing, as it has a series of steps and also keeping a sterile field. We want to avoid breaking the sterile field because it can lead to complications with the patient. So with that being said, there is a lot of anxiety that comes with learning a skill that's such a high importance. So we're looking at performance anxiety and ways we can modulate that and reduce individuals' performance anxiety. So they randomly assigned to a modality. They're going to learn their skill through that modality. So for example, if it's the VR with controllers, they're going to learn the skill using VR with the controllers. From there, they'll come back into the lab and they'll perform an independent assessment of the skill itself. We're not teaching them how they're learning it currently within the lab itself. We're teaching them the principles. Everything we've done has been modified, but it can be adapted into a real life scenario. And that's the thing, adaptability. Are you able to adapt? It's not about the steps. We're not asking students to come to the study, memorize these steps as they're learning, and then we're evaluating them based on the steps that they hit. We're asking them to critically think about why they're doing what they're doing.
It's kind of like seeing another aspect of something. So if we were to learn the skill in the lab, we've got our book, maybe a video that sort of is alongside the book and then our professor teaching it to us, but sort of having that teaching aspect to showing other students reinforces the skill a lot more too. So, I'm learning a lot more teaching than I am just learning.
So within the virtual environment itself and this skill, it's not exactly how they would see and feel and touch things within a lab environment. But what carries on is the core principles that we're trying to teach these students. So this skill looks a lot different compared to how they learn it in the lab. It involves different materials and so on. But we try to mimic and copy that as best we can within a virtual environment. Students can actually learn this skill by just picking up a headset, logging in, and then doing the skill as many times as they want. They feel like they're in that environment, and with the haptic gloves, what makes this a game changer, which most studies have not looked at, is trying to do the tactile portion or the motor movements of the skill itself. So picking up objects. So we have these gloves. They were from a company called Sense Gloves. They work on a lot of different projects with medical students as well. And what it does, it replicates tactile feelings that you will feel within the virtual space. So if I pick something up in the virtual space, I pick it up with a glove, I feel tightness, and it actually makes me feel that I'm picking up that object. We're going to have an influx of students, this new generation that are used to doing things virtually. We're going to be fighting for their attention spans. And in doing so, we have to find creative ways in which we can teach things. And virtual reality can mimic that in trying to entertain, but also learn a skill. So the student needs to feel 100% safe in learning the skill itself in their environment, and they need to feel trusted with whatever way they're learning it. One of the things that we can run into in the literature and what the evidence is speaking to is students often hype up maybe a skills testing, increasing their anxiety, and then ends up in bad performance, and then that leads to unsafe practice. So in an environment like VR, or with this study, what we're looking at is performance anxiety and ways in which we can reduce that so that we can have psychological safety with participants. So students learning feel that they actually are learning, they're not being misled in any area, and then their performance anxiety is not being heightened and increased that would lead to bad performance or lead to unsafe practices. This is what you would sign up for when it comes to a degree program. At one point, you're getting high education and you're starting to become more of an academic with a higher education, such as the degree program I'm currently in. But when you add on a research component, what you are doing is you're opening up a different lens that you often don't see. With that lens is the ideas of keep wanting to explore and never be content with what goes on currently, definitely within the education and even within healthcare. We can never be content, we can never be satisfied, we need to keep thriving. So we have the academics to help back our research component. So the academics will teach us the foundations that we need, the theories, the critical thinking, the competency and the decision making that we can create as academics, and then taking that and bringing it full force into research just really guides an overall performance of an individual wanting to be part of a research team.